right, this is a pretty big health message we're going to get into, because your whole life, your whole life is from your first breath when you're born to your last breath. So we want to make that period of time as long as possible. And you can go without food for, weeks, longer than that. You can go without water for days. You can't go without breathing, but for just a few minutes. So it's really, life is all about breathing. And you do it right, and you live a long, vibrant life. You do it wrong, and you shorten your life. And doing it wrong, basically, is mouth breathing. And mouth breathing is really the thing that we're after the most, because it's causing the most problems with kids and all the way through life. So our main goal is to do everything we can to stop mouth breathing. Well, there's only one way you can do that, really, and that is to train people with taping their mouths closed. And so it's a laughing matter. You talk about taping mouth closed, and everybody laughs and says, well, I can't wait to tape my husband's mouth shut or my wife's mouth shut. Greatest thing in the world. But anyway, but it's no joke. I mean, it does sound funny at first, but unless you can keep your mouth closed all night long, you're not breathing properly. And when you're breathing through your mouth, you're not getting any of the benefits of the nasal breathing, which are manifold. First of all, you're not getting enough oxygen to the brain. Now that ought to get your attention. The second thing, you're not getting any benefit of air filtration through the nose and sinuses. We manufacture kind of a miracle molecule called nitric oxide. And it is a viricide, it is a bacteriicide, it's a fungicide. It's amazing how it sterilizes and purifies air. Well, if you're breathing through your mouth, you disregarded that. You don't have any use of nitric oxide to benefit you. The nitric oxide has many more benefits than that. It helps to open up the arteries, the blood vessels. It helps to calm you down, to activate the parasympathetic nervous system. Like I say, the purification of air is its biggest contribution. So anyway, you don't want to lose out on the benefits of what your nose and sinuses can produce for you. The next thing that's really important is that this sounds like an exaggeration, but about, I would say, over 90% of the orthodontic problems, the crooked teeth, the jaw development problem, are due to mouth breathing. So it has a real effect on how the face develops and matures and functions. So there again, it's a signal, vital sign for us to be concerned about. So naturally, we've been interested for over 100 years in orthodontics with stopping mouth breathing, not knowing at all that it's connected to sleep and the sleep issues that people have, sleep apnea. So there we go. When we get to the 70s, now we're finding out that the sleep apnea is the new end disease, and how widespread it is. And that's really in the early 70s, about 1972, when it was really a diagnosed entity and started gaining slow traction. Is a real problem in America of insufficient sleep, inadequate sleep, sleep disruption through sleep apnea. So that's a long way to answer a question, but I hope you can see the ramifications of living a healthy life with breathing right.